Are you one of those people who always take antibiotics? You have headache, antibiotics. You're coughing, antibiotics. You're feeling weak, antibiotics. You traveled and came back, antibiotics. And you have turned your body into a pharmacy. Are you one of those people? Because not only are you causing problems for yourself, but you are causing problems for the society. Let me tell you what happens when you take a lot of antibiotics. The time is coming when you will need the antibiotic. You will actually really need it, but it won't work for you because of resistance. So you know what they used to call, or maybe they still call it, odechi. You know, when you beat a child and the child just dusts it. You beat the child, you know, children that you beat over and over again, and to the point where now when you want to beat them, they just put their back to you and say, yes, go on. And even if it is 100 lashes, they will not even shift or move. So that is what happens with these organisms. You see, these organisms are also very adaptive. So when you keep giving them some kinds of antibiotics, they will also work against that antibiotics. Then pharmaceutical companies will need to be developing stronger and stronger antibiotics to deal with the same problem. And you, just you, are a big contributor to that problem. And the problem is now not just for you, but for everybody. Another thing that can cause this problem is when you are now given antibiotics and you are told to take it for 5 days or 7 days, and because you feel better, 2 days later, you stop taking the drug, you are also a part of the problem. You have to use drugs the way you are given. And you don't use drug when they are not prescribed to you. Some of you just go to a pharmacy and then you just go and buy. Remember when small drugs like chloroquine used to just be okay for malaria? Now we are using artemisinin base, that is combination drugs. Same thing is happening to antibiotics. You hear in the past, you knew of that penicillin, right? And then we started using the likes of amoxicillin. They had to mix it with clavulanic acid, and now we are having cefixime mixed with clavulanic acid, and they are getting more and more expensive. So you're making healthcare more and more expensive. And then you will say, oh, and I've been taking this drug and it is not working, because you are a part of the problem. You know what can also happen? When you keep taking drugs that you don't need, when you're not putting certain considerations into how you take the drugs, you are taking them at the wrong doses. You can damage your liver, you can damage your kidneys, and then you'll just be out there begging for money for kidney problem and stuff. And then people will say, oh, she doesn't drink, or she doesn't smoke, or but she's having kidney problem. What they didn't know is that you were putting drugs that you didn't need and knocking them up together, taking multiple drugs that do the same thing and taking them together. You are not using drugs rationally, and you are a part of a big problem. What are you going to do now? Number one, don't take drugs, especially antibiotics, unless they are prescribed by a doctor. Number two, when they are prescribed, take them the way you are supposed to take them. Number three, don't say, my neighbor, when this thing happened to me, this is what they gave me, so you too take it, because your problem may be different from your neighbor's problem. The concentrations that led to your dose may be different from the dose your neighbor will get. And your age, your weight, so many things go into what determines the drug that you are given. Your health condition, your past medical history. That is why we ask you questions when you come to the hospital. They determine what we give you and how we give them to you. So don't be one of the ignoramus. Don't be one of the people that cause problems for the health system. Behave differently. Do differently. I trust you. Once again, I'm Dr. Amira Adiola Sonny. I am a full-time doctor and only a part-time content creator. So press like, share, and follow me so you can see more of my videos.